Hello, everyone. I'm Carol Fleck, and on behalf of the ADDitude team, I'm pleased to welcome you to today's ADHD experts presentation titled Health Equity in ADHD, Addressing Racial Disparities in Diagnosis and Treatment. Leading today's presentation is Dr. Napoleon Higgins. Dr. Higgins is a child, adolescent, and adult psychiatrist in Houston, Texas. He is the executive director of the Black Psychiatrists of America and CEO of Global Health Psychiatry. Dr. Higgins is an author and co-author of multiple books on ADHD, depression and grief, mental health in Black communities, and physician practice issues. He also specializes in nutrition and health to improve patients' well-being. In today's webinar, we'll discuss the critical issues that often prevent Black children and adults from receiving adequate treatment for ADHD. These issues include structural racism, which often results in limited access to ADHD care, as well as harsh treatment and punishment at school. Stigma around diagnoses like ADHD and a deep mistrust of the medical community are also barriers to care. Our expert will discuss the serious consequences of untreated ADHD and share strategies to help ensure proper care and treatment. We'd like to begin today's webinar by asking this poll question to our live audience. In your experience, what qualities or aspects have you found most challenging in the search for adequate ADHD care? Please select your answers and comment in the text box under the video player to tell us more. For answers to common webinar questions about slides, transcripts, and certificates of attendance, click on the FAQ tab of your webinar screen. If you support the work we're doing here at ADDitude to strengthen the ADHD community, we encourage you to visit additudemag.com/subscribe and sign up for ADDitude Magazine. The spring issue is out now, so you can look for articles on divorced households and managing children's needs, and read our experts' advice on managing big emotions before they bring you down. Subscribe to ADDitude Magazine for yourself or to share with a teacher or a loved one who could benefit from greater ADHD understanding. Click the magazine tab on screen to learn more. So without further ado, I'm so pleased to welcome Dr. Napoleon Higgins. Thank you so much for joining us today and leading this discussion.
Well, thank you so much for your introduction. It is great to be here today. I've heard a lot about ADDitude, and I'm very thankful for the opportunity to address the group. I realized that, ADDitude is large, but once I saw that the notification went out that I would be speaking, a lot of friends hit me up like, hey, man, I see you're going to be on ADDitude. So I have friends here, those who know me, those who do not. But it's great to be here to talk about such an important issue of health equity in ADHD and addressing racial disparities in diagnosis and treatment. As stated, I'm executive director of the Black Psychiatrists of America and do a lot of different things, but, really doing ADHD and treating ADHD is a bulk of the work that I've done throughout my professional career. I do have several disclosures to state. I do speak for several pharmaceutical companies. I'm actually out of town right now. I'm in Las Vegas, preparing for a talk that I'm about to do in about another 3 hours for a pharmaceutical company, maybe about another 5 hours. So these are the companies that I speak for. The majority are included here. But let's jump right in. The issue of undiagnosed and misdiagnosed ADHD, as we all know, it causes missed opportunities. So far as the issue of not focusing, not paying attention, difficulty concentrating, and then, the issues that you have starting in school, especially if you're having behavioral problems, inattentiveness, you're not learning as you should. And then a lot of people start to judge you, that maybe this kid is not doing as well or can't do as well. And the issue of possible thinking that there's a character flaw or a character issue when it's actually a medical diagnosis that actually can be worked with, but also the issue of neurodiversity that some kids think differently. So with the school systems, often they are set up in a certain way for the majority of the students who are there. And part of that makes sense. But then you also have the neurodiverse individual right? Who also has the ability to learn, but maybe be in a situation where they learn differently. So without receiving adequate care, you can have a lot of problems that can occur throughout life if it's not identified or addressed properly. Other contributing factors that we may not notice that can definitely happen in any community, but also in the Black community, is the issue of trauma. If you did not sleep last night because of nightmares and flashbacks, or the issue of poverty, where 25% of Black children in this country live underneath the level of poverty, the lack of food can occur, not knowing where life is going to head because of the issue of changes that continue to occur. The issue of nutrition, inadequate nutrition, so far as being able to afford the right foods, or being nutritionally, not knowing what are the correct foods to eat. So often we'll feed our kids, Pop-Tarts, Flaming Hot Cheetos for breakfast, for lunch during spring break. That becomes like two bags of Flaming Hot Cheetos. And then for dinner, we'll do like 3 of them, right? Well, the problem is that if your child's brain is running off Flaming Hot Cheetos, it is very difficult for your child to be able to learn in school without a good nutritional environment around them, but also the environmental issues that occur in our neighborhoods. 2 out of 3 landfills are located next to Black and brown communities throughout the country. All right, 2 out of 3 or 3 out of 5. Myself, I grew up a few hundred yards from the landfill. And so this issue of being, the gases and things of that occur that come off of those things, also living near industry, are the issues of smog and environmental toxins that are in the air. Those also do impact your ability to focus, pay attention, because of the impact of the environment on the body, but also the impact of the environment on the brain. Other comorbid disorders that are often missed, so far as depression, anxiety, even bipolar disorder, or even before the talk we got on, we were even talking about schizophrenia. All of those can look like ADHD. And I tell people this: when you're looking at ADHD, it is a diagnosis of exclusion. So essentially, I ruled out bipolar, I ruled out schizophrenia, I ruled out anxiety, I ruled out PTSD or trauma, I've ruled out the issue of sleep, and now we're looking at ADHD, because the fact is this: in every psychiatric disorder, you're going to have difficulty with focusing and paying attention. Every last one of them. All right? Now, with most medical issues, you're going to have difficulties with paying attention and focusing as well. So we have to look at other medical diagnoses. So essentially, if you have COVID and you're coughing all the time and sneezing all the time, I can guarantee you, if you don't feel well, you cannot focus and pay attention. All right? Or if you're having heart disease or asthma or any of those types of things. So we have to make sure that we're paying close attention to making a clear diagnosis of what we're doing. And then you're looking at the issues of explicit and implicit bias in clinical research and evaluators, in that the teacher can be biased, the researchers can be biased. And how does that occur? Well, just for example, I speak for several, pharmaceutical companies, and I was at a training, and they specifically said that in this particular study, that is shown that Black and brown kids are more likely to have opposition defiant disorder and conduct disorder. All right. 2 issues with that. One is the study didn't say that. It had the study didn't even look at those particular issues that they had quoted, and they even had a reference for. But the second part of that, you have to look at the explicit and implicit bias of raters when you're looking at, especially looking at Black children, and even more so even Black males who may be having symptoms of ADHD. So how do you find a clinician to treat ADHD? Well, there are multiple people who can treat ADHD. So I am a child and adolescent trained psychiatrist. I also see adults and I see elderly patients as well. So I see all ages. But I am the subspecialist. But there are a lot of other people who can treat ADHD as well. You have your psychologists who even have your subspecialty of child psychologists, but your pediatrician, your primary care doc, including family medicine, even your internal medicine docs as well, neurologists, and there are a whole host of nurse practitioners and other individuals who could treat, who are clinicians who could treat ADHD. So I'm the specialist, or if I would say the subspecialist, and some would even may say the subspecialist. So you don't have to see me first. There are a lot of other people who treat ADHD, and understand that the majority of ADHD is treated outside of psychiatry. It's treated in those other areas, but then we're the specialists who deal with it as well. So insurance provider, you can look on the number on the back of your insurance card. They're normally going to be at least 1 to 2 numbers. One is just a general number, but a lot of insurances will have a second number on there specifically for mental health and substance abuse. So look, your insurance provider, you have your county services if you don't have insurance. So you have your catch network for persons who may not be insured or inadequately insured or even are impoverished. I'll mention one group here, the Black Psychiatry Directory.com. That is a directory of the Black psychiatrists who are in the country. That is not a full directory, all right? But, understanding that if, for Black patients, they'll want to see a Black psychiatrist. And when I see that, I have to let people know only 2% of the psychiatrists in the country are Black, and about half of them are located in about 5 cities. Houston, Atlanta, New York, DC, LA, and then obviously there are other psychiatrists in other large cities, Chicago, your major cities. But then there may not be a Black psychiatrist where you're looking at. I like the website Psychology Today, doing a Google search, on its own. All of these ways are different ways in which you can contact a provider. Schedule an appointment. A lot of times we'll want to see somebody, but we'll fear about it. We want to consider it. I would say if you think you need to see someone or your child needs to see someone, schedule an appointment and then look for the confident compatibility. When you make the appointment and you go in, do you feel comfortable with the doctor? Did you come up with a follow-up and a treatment plan to move forward on the issues that are impacting you about ADHD? And if you don't agree with that doctor, there's nothing wrong with the second opinion. Or if you're getting treatment and it's not getting better, nothing wrong with that at all. And I highly recommend those. And I do not get upset with the patient if they want a second opinion. Sometimes you do need a fresh set of eyes on things to see how there may be another way to approach your particular issue. So how do you find someone? Is your doctor culturally competent? This is something that Black people often fear is, will the doctor understand me? Will they get me? So often when we have a majority culture, which would be white culture in our country, people will believe that everybody sees things the same way, or the best way to see things is how the majority sees it. And that comes about because the majority gets to say, the majority may be controlling most of the resources. The majority says what ADHD looks like for everyone, but everyone does not have the same visual or come from the same standing point of looking at ADHD the same way. And it's hard to know if somebody's culturally competent. Now, the fact is this: I am a Black male. I grew up in the Black community. I've been Black my whole life. All right. And I've pretty much gone to all Black schools my entire life. So I have a very singular view of America from my lens. At the same time, I live in a majority culture that you're constantly inundated with white culture as well. So at television, radio, print magazines, the educational system, the government itself, all of these things come into play. But as a psychiatrist, I'm also wanting to know about other people's cultures. So you have to make it a point to read stuff, listen to stuff, watch movies, podcasts, whatever it may be that may be outside of your circle, because as a psychiatrist, you are a social scientist. You need to understand cultures and people. I live in the city of Houston. When it comes to the city of Houston, half of the people who live in the city of Houston were born outside of the United States. So the city of Houston is about 2 to 2.5 million people live inside the city limits, with about 7 million total. You got to understand where people come from. All right. So I definitely want to understand issues. And if I don't understand, then I will ask you, please explain more, because really I do want to know. And to all of my clinicians who are listening, when you ask a question, it does not show ignorance. Asking the question shows that you are interested in what is going on with them and what is impacting them. So make sure we talk to our primary care physician. Sometimes they will know someone that is very good, that they would feel comfortable that they send you to. And then your community and faith organizations. So often As African Americans, we talk to our pastors, we talk to people inside of our church, within our friends, sororities, fraternities, barbershops, all these different places we'll go when we ask for where do we find someone good to talk to. And between all of those people, they typically know someone. Even if they're not African American, they'll say, well, this doctor's really good. He really helped my child out. I would highly recommend going to see this particular physician. So stigma. There are a lot of negative attitudes and beliefs that happen inside of all communities, but specifically, I would say the Black community, where people will say that ADHD is not a diagnosis. It doesn't even occur. That's something, be honest with you, I've heard this said before. This is something that white people made up to get Black children in trouble, and a lot of negative attitudes and beliefs. And I've even seen that in my own practice. I had a young man who came in where the mother said that, the white teacher said he had ADHD. And then the next year, the white teacher said he had ADHD. And then they sent us to the school counselor who said the same. And then we ended up being referred to a doctor. He said the same. So I did a full evaluation. And I said, well, ma'am, it does seem like your child has symptoms of ADHD. After looking at all the paperwork, and we got the rating scales back. And she told me, well, see, you think like those white folk. So understanding, just because I'm Black does not mean that everybody believes my diagnosis, but these negative attitudes and beliefs can put a barrier between somebody who needs help and somebody who's needing treatment. All right, to the actual caregivers. And these are really real things that keeps people from seeking help. The issue of fear and shame, I've seen parents say that they feel like they let their child down, or that they did something wrong, or something looked down upon. But the other issue of fear is, well, when we look at ADHD and what typically happens to the ADHD child who is Black, all right, you have to look at how the system treats that child. The majority of majority of adults who are locked up have ADHD and impulse control disorders, and Black people are locked up at a higher rate. And then we're going to talk a little bit about the school system and how we could treat ADHD. And you find that there's a real reason to be afraid. So the fear is not from a situation of, Black people don't trust America, which that can be true as well. But the other part of that is there is a real fear that can occur with the diagnosis, and trying to make sure that people navigate that fear to know how, once we have a diagnosis, that's actually to your child's benefit so that we can get them the services that they need. Looking to faith versus mental health. The fact is that, I would say 90% of Black people are religious, 90%. Actually, that's 95%. And about 90% of those are going to be Christian, and about 5 to 10% of them are going to practice Islam or another religion, Judaism, and a lot of other religions. So the fact is this: not all Black people are the same, but they're more often than not going to be religious, but not all will be. And most will turn to faith when it's talking about mental health or even physical health. So if you have a health condition, people see on Facebook all the time, please pray for me. I can't wake up in the morning without getting 3 or 4 people on text messages with the prayer for the day coming from my community. So turning to faith is actually a positive thing, especially if it helps your mental health. So I'm never against, turning to your faith, but also knowing when you need a mental health professional. And I've found that in the last several years, I see that more churches are turning to mental health professionals and recognizing the value that we could be for their membership. So this issue of hesitancy, misinformation, misunderstandings, and fear of treatment are big. Are these illnesses? I've heard families say, they fear that they're being mind controlled, or that the medication is going to be, they're going to give your kids something that's just like crack. And it's the reason why crack is so heavy in the Black community is because doctors are giving them ADHD medication. I've heard this before. And the odd thing is that Black children are less likely to be on ADHD medication and less likely to be diagnosed. But this fear of mind control by medications, the fear of labels, and that people fear that my child is labeled, so therefore they will never be able to do well, or the system has labeled them so that they will not be able to move forward. And what happens is this: I make the diagnosis, I let the school know, or the parent lets the school know, and then they'll see that special education services are now involved, and they become afraid. Now they're trying to put my kid in special ed because they have ADHD. And what I explain to my families is this: all educational services that require more funds go through special education. So if your child needs accommodations made, that does go through special education. If your child is gifted and talented, that goes through special education. AP courses or special programming at the school goes through special education. All of that is special education, but knowing how to navigate that so that you can receive the services needed. And what is odd is that I'll have my Black families, often, not all, who will run away from special education services. They're afraid to let the school know because they're afraid of labels. And then next thing you know, they will go without services. Where my families who are majority white will run to those services or want special services because there's more money there. There's more contact with professionals that can help you there. And so we have to get through that misinformation and misunderstandings, because we may think that the family is being non-compliant, but there may be a actual real fear that they have on why they're not engaging. The mistrust of the medical community, we all hear about the Tuskegee incident, but realize that racial disparities go on every day in this country. There are racial disparities, and then also between outcomes of Blacks versus whites, and then outcomes that Black patients have with white doctors versus Black patients with Black doctors. There is truth to that. That's not the point of this talk, but if I got plenty of slides on that as well, with studies that are steadily coming out that show that Black families tend to have worse outcomes with white doctors. And that is a sad thing to hear. But if we could educate more, maybe we could change that. The access to quality care, so far as, do you have insurance? If you don't have insurance, are you able to get quality care through the community systems? But even for the insured, sometimes all treatments are not covered. And if you have money and the medication is going to cost $500 this month because we're going arguing back and forth with insurance, most families are not going to have $500. But there are families that do. That gives them a distinct advantage. Or being able to see a professional. If you have insurance versus if you're paying cash, the fact is that somebody paying cash can get in normally a lot quicker than somebody who has insurance, especially if they have, a governmental type insurance, or obviously those who don't have insurance, right? And don't have money either, who are not on Medicaid, Medicare. Understand this. There are people in our country, and Black people have a higher number of this, who fit within the social services of being able to receive government insurance, but they don't have that either. All right. So the access to care quality ends up going through the emergency room or urgent cares, but then you're not able to receive treatment for ADHD in those areas. And the misdiagnosis of ODD and conduct disorder. Oppositional defiant disorder and conduct disorder. Understand this. That is a diagnosis that is majority diagnosed in Black and brown kids. And this is shown medically, statistically. The numbers of ADHD versus ODD and CD are actually more skewed towards Black and brown kids. And I find that this is typically the issue where the diagnosis is difficult to treat. So if you are Black and your ADHD is not responding to the regular medications that we would expect, especially if you have an impulse control or an anger issue or the emotional impulsiveness of ADHD, if we can't get it right, then it must be ODD and conduct disorder. And sadly, I'll see these kids or families come to me, especially, being Black in the Black community. They'll say that, my child is not getting better. Go see Dr. Higgins. And I'll find that the doctor never increased the dose of the medication. Like, you started the starting dose, which normally the starting dose is not adequate enough, and never increased the dose. And so I tell families, all right, your child may have opposition defiant disorder, or your child may have conduct disorder. But I don't know that until we've adequately treated the ADHD. Until we get the ADHD under control, that medical diagnosis under control, then I don't find the other two to be relevant until we do that. And oddly enough, normally when you get the ADHD under control, all of a sudden they're not oppositional defiant or conduct disorder. I had a young man diagnosed with that for multiple years. Once he got well, next thing you know, he's making A's in class. He still struggles in math a bit, so he makes some C's in that. But many times he made the AB honor roll. Now he's a star basketball player looking at going to college with scholarships. But someone had inadequately treated his ADHD over years. So this fear of bias and trust is something that I always want to make sure that we understand is a component in the room that may not be discussed openly. And then the cultural competence and understanding the individual in front of you. So the trust of the patient to the doctor, but does the doctor actually trust the patient? All right. Does the doctor believe that you're going to follow the options that the doctor is giving you on what to do? The fear of a lack of compliance, so that you're not going to take the medication, or judgment that there's nothing that we can do for this kid. This kid is just bad, and you've got a bad kid, whatever bad means, because all of that really can change when it comes to treatment. You have a bad kid, there's not much we could do for you. So we're not even giving you all the options or all the things that we can do. And also how Black people describe mental health can be different. All right. So I'm using my, I'm using my culturally appropriate voice to a large community of people who may be very diverse. But when I'm speaking to, say, in my home, I can speak very differently. All right. Plus, I'm from the South and I'm urban. So I have a different dialect that often can come out when I'm very comfortable. And so when people are speaking to you, they may be communicating the symptoms very differently. So I have a family to say, did your son have ADHD? Well, he doesn't have ADHD when he's on his phone. He doesn't have ADHD when he's playing the game. All right. So he never has ADHD then. So I know he can pay attention and focus. Well, ADHD is deeper than the phone and the TV and the game. Now, if I tell him to do something, all of a sudden he can't hear what I want. He can't hear what I'm saying. Or he'll do one thing, but he can't do the rest. So he does seem to have ADHD. Not really. Not at all. I can tell you right now. So I don't even know why we're here. Well, the thing is that if you don't go deeper and know how to ask the questions, she's telling you the diagnosis, but she's using verbiage that is different. And it's the doctor who has to pick that information out of the patient. I remember I had a parent once told me, look at this boy. He is so thrown. Just look at him. All right. Now, a lot of people who are not from the South or not urban may have no idea what throat is. But I knew exactly what she was saying. I found it to be funny. Like, what if she said that in front of one of my colleagues? I don't know if they would pick that up at all. Now, this issues of discrepancy, even inside the school system with teacher and parent, we're looking at, that was this 2020 video clip. There's a study done by King. He did several studies on this, where it found that what they would have is Black and white children in a classroom. None of them have ADHD, but they would have the teachers and the parents to rate the kids and try to pick out which kid has ADHD or could have ADHD. And it found that the white teachers were more likely to see ADHD in Black children than Black parents. All right. So the white teachers were more likely to pick out kids with ADHD, and they skewed more so towards higher ratings for Black children. On that same study, they looked at white teachers and their attitudes towards race. So the more they had a negative racial attitude towards Black people in the rating scales, the more likely they were to see ADHD in the Black kids. So what they're trying to pick up is how racist is this person? And the more racial they were, the more likely they were to see ADHD in Black children. And they were also more likely to see it in Black male children. Now, Black parents were less likely to see ADHD in their children and Black male kids, but Black parents who had higher rates of racial discrimination also saw more symptoms of ADHD in their Black kids. So if you had a history of racial discrimination towards yourself, you were more likely to see ADHD in Black children. And a lot of people would think that this may be a protective factor, and that you don't want your child to be a target by the white community because of their behavior. So if they're acting up or are not acting in a way in which the white majority will accept, you're more likely to have tighter control over them in fear that they're going to be targeted because of their behaviors. So this fear is real. The fear that the Black teacher has, the Black parent has, inside of the classroom of their child being told by a white teacher that they have ADHD. Well, in his studies, he's shown that this is repetitive over and over and over, that white teachers are more likely to see ADHD in Black kids. Now, the kid may have ADHD, but it is definitely skewed. African Americans are 3.5 times more likely to be suspended or expelled in schools. All right, that's just a flat out number. Children with disabilities make up almost 9% of school population, but comprise 32% of juvenile detention. So 32% of new juvenile detention are those who are neurodiverse, but 1 in 4 Black students with disabilities, such as mental disabilities, will be suspended versus 1 in 11 white students. And when you take a child out of class, they will not learn information when they're away from the classroom. And then the next thing you know, you give them more unstructured time because they're not around an adult. And we see this with, pictures of kids being arrested, Black children being jailed, using a fake law. We've seen where I remember it was a judge who got, arrested and jailed behind sending kids with, behavioral problems to jail because they were getting paid, because the judge was getting a kickback in order to do so. So we've effectively in this country made ADHD a punishment. Kids who are neurodiverse, we've made them punished like this is something bad, where we're pushing them towards alternative schools. And then when you go to alternative school, you're more likely to end up in prison. So it is the schoolroom, classroom, cradle to prison pipeline that we've effectively are using ADHD in order to do so. So far as prioritizing punishment over rehabilitation education, I don't know. I see a lot of bad kids who all of a sudden with treatment, they're not bad anymore. Seeing the therapist, working with the family, possibly needing medication, all of a sudden, this kid who couldn't go anywhere is going places and doing things that are positive. Increased law enforcement impact inside of the school. Obviously, this is a different generation where they have school shootings, right? This didn't happen when I was in school, that people feared being inside the schoolhouse. Well, now that you have police inside the schools, police are not trained educational individuals, and police are not trained in childhood development. So we increase law enforcement, we've decreased funding for counselors, and we've decreased funding for special education services where our neurodiverse population needs to be. And I will tell you, I'm a neurodiverse person. I've been told my entire life, even as a doctor, I became, that I have difficulty with reading comprehension. Wow. All right. I'm a doctor. They say I can't read. Well, I can read, but I'm reading right now. But the fact is that I'm a different type of learner. So I found that if you give me a sheet of paper that's organized, I can memorize the entire sheet, or I almost have a photographic memory where I can see the entire thing. So I know that as a doc, if it's written this way, I know how to put my glasses on now to a way where I change up my thinking, where I can read long paragraphs effectively. I have to learn that over time. But also, if you give me a paragraph outline form, I can see the whole thing. Give me 5 minutes and I can memorize the entire page. But I learned that I'm neurodiverse and I learn differently, maybe not like everyone else. Alternative schools often do not have the same requirements of the public school. So when you take the child out of the classroom and you put them into alternative school, they go from a teacher who is teaching to possibly a teacher who's just handing out worksheets. All right. That becomes a problem when you're not learning what your peer group is learning and you have to do 30 days or 90 days. And you start to have the conversation and talk where you're talking penal talk when you're talking about days that you've got to do versus educational requirements. And then when you run them back to the regular system, they're unprepared and fall further behind and increasingly frustrated because they may have missed 90 days in alternative school is basically half the school year. All right. If you get 90 days in alternative school in September, you're not coming back to school until January. All right. And then when you do this, you increase incarceration rates and you decrease graduation rates when you do this to kids. Zero tolerance policies. So far as if you act up, you automatically get this punishment, no matter what's going on with you. This causes increased missed school days. You have a kid who's struggling, who's now not being supervised, maybe if they're at the home by themselves because the parent is working. Suspension rates are increasingly and have doubled over the last 30 years for all kids throughout the United States. Leaving kids unsupervised increases the chance of fallout. You don't have due process when you have zero tolerance policies. There's no investigation, and then there's no change in the community or within the culture or where the child is living in the environment. I remember being in the 4th grade, and the teacher was told by another student that another kid had a knife in class. And so the teacher, immediately, came and looked in the child's bag and pulled out a knife. And she's like, "Why do you have a knife in the bag?" And she said that the older kids from the middle school are bullying her and her sister, and they started to push them and hit them. So she brought a knife to defend herself. Well, what you could do is kick this kid out of school, put her out of school. So next thing you know, she loses the 4th grade of her education and has to repeat the year. Or you can actually talk and find out what's going on. They knew the kids that were bothering them. They spoke to the families, all right, of those kids, and they got those, middle schoolers, 11 to 13-year-olds into the home and away from the kids. And it completely stopped for all the kids in the neighborhood who were going past these other juvenile young men. When I say juvenile, not juvenile jail, but just juvenile in age group. That was an intervention that stopped the entire thing for a group of kids leaving the elementary school. But if you do zero tolerance policies and you're not going deeper into the situation, you can have a lot of kids who are getting messed up by the system, by adults not doing their jobs correctly. So you take away the protections that are by the school for kids with special needs, and you put the law enforcement in instead. And this is a bad setup for all children, no matter what their race or color is. With law enforcement inside the school, you're more likely to have school-based arrest, rather than teachers intervening, and you have now more arrests for children in schools who did not do anything violent but had some sort of disruptive behavior. Because if you call the cops do what they're trained to do, all right? But they're not doing what a school counselor is trained to do. And we need to make sure that we have more of that because it sets up a poor outcome. So when you incarcerate kids, they don't graduate. And when it comes to that, 70 to 80% of all Black men who do not finish high school will end up incarcerated. 40% of Black men who have a diploma will end up incarcerated, and those with a college degree is about 8%. So school is important for our neurodiverse children. They need to be in school, in class. We need to make the intervention because if you don't, the outcomes are poor. So when you look at a Black family and you're looking at a 6-year-old and the mom comes in because there's a school issue, she's afraid, she's scared, she's afraid of the system, and then you diagnose ADHD and she starts to cry. Why? Because the system is in a situation where this kid is more likely to end up incarcerated, even though she's showing up for help. So what she does is she tries to not show up. She tries every other intervention, any other way we can do it, including spanking or beating the kid, because the system will do a whole lot worse. So now, when I say that, I'm not proposing spanking kids at all. I do propose that you get the help that you need, but we need to make sure that we're in a situation when you get the help that you have the correct outcome and not this outcome right here, because the reason that she's crying is the system with ADHD in Black children does this right here. So parent training, do all the models fit? Clear expectations. You need to know, what are the expectations of the child? Does the child have an expectation? Do they know what's going on? What is the expectation of the parent? And what is the expectation of the clinician? Do not assume that your model or your idea is the best fit for everyone. I remember, I don't want to go through too many analogies, but no, it happens all the time where you're not knowing what the family is looking for when the doctor or the clinician comes in. Positive reinforcement. For the tired parent, that could be very difficult. If you're working 2 jobs as a single mom, you left work at 6, you can't, and then you had your second job, you're not getting home till 10 or 11 o'clock at night, that can cause difficulties. Effective communication is something that is very important for parents to be able to do. For the busy parent who's not at home, be careful. Also look out for who else is taking care of the kid. The fact is that, especially in single parent homes, If the parent is not there, it may be the oldest child who's responsible. It may be a grandparent, friend of the family, somebody from the church. So if you're effectively communicating with the parent in the room, but when the kid comes home from school from 3 to 9 o'clock at night, they may not even be seeing that parent. So it's important to make sure you do a good assessment of what are the situations in the home. Consistent discipline can be very different for an exasperated parent, who has to go to work, doesn't have time to deal with certain things. Emotional regulation has to be very carefully controlled. You have to look at the power of the teacher of the classroom. When it comes to dealing with kids, the teacher has a ton of power. The school system has a ton of power. And if the parent and the school are not on the same page, it can actually be a heavier consequence to the parent than some would recognize. We need to make sure that we're promoting problem solving for our kids, identifying the triggers, identifying alternative solutions that actually fit within the situation that is going on inside the home. We have to look at the collaboration of parents and the consistency between homes. So if the parents are divorced, mom has these set of rules, dad has that set of rules. But then grandma, who actually is taking care of the kid when they get home from school or where they go after school, has a whole different set of rules. So we have to make sure that all of the child's circle is on the same page to make sure we have the best outcomes. And then the issue of ongoing support, the ability to afford the support can be problematic for families who are in those margins. Make sure that parents and children know their rights, educational rights, information, Individuals with Disabilities Education Act, 504 plans, individual education plans, special education services, other accommodations can be done for this child, for the college. I've been writing letters for college students a lot lately, and even for the adults on the job. And that can be kind of tricky, when dealing with adults in the workplace and ADHD, and some of the letters I've had requested. I'm like, anyway. So comprehensive treatment plans are important, making sure that everybody's ideas and where we're trying to go is locked in and together. Parental consent for services. Obviously, you can, as clinicians and professionals and as adults and teachers, we may want services done for a child, but we have to have parental consent, making sure that they're on board. Legal guardianship versus decision making. As I said before, grandma may be making the decisions. I've seen a parent show up with the child in the room and the dad, mom and dad show up with one child. And there's somebody else who's going to make the decision on whether or not we're going to start medication or treatment. My thought is I want everybody inside the room who's within that decision-making capacity. I want everyone there, because Big Mama may be the one who's making the decision and not either one of those two parents that are inside the room or the child. We got to make sure we advocate for our kids. I've written many letters. I remember writing a letter for a kid for special services. Despite my letter and what the teacher said, they decided to deny services for this kid, and the entire administration at the school got fired in the middle of the school year. All right. Now, why they chose to say that we're not going to follow what the doctor says, we're not going to follow what the psychologist says, we don't believe the child needs any of those services or help or care, but realizing that these are legal documents that you're filling out when you're receiving services. And sometimes you need an advocate or an ombudsman, even within the school system, to make sure that we're getting the right type of services for that kid. So what can we do? Hopefully today we've increased education to ourselves, to our families and children, and other providers. We need to understand these barriers that occur inside the room. So these unspoken words and these unspoken fears and trust issues are there. Ask the family if they have any questions. Make sure you're listening to what are their needs, what are their desires, what is it that you want me to do? Because honestly, when you're in my room, you actually paid to come and see me, either by cash, copay, or by paying insurance, and you're there for a reason. Nobody sees a child psychiatrist because you just felt like it today. That's like going to the dentist. We go there for preventive care, but nobody feels like getting dug in the mouth. All right. So these are things that we have to do, that if they're in front of me, then they went through multiple mental steps normally to be there. We have to be flexible, in listening to people and what their desires are. It's not everybody is the same. All right. Educational interventions and services have to occur for our kids there needs to be an end to zero tolerance policies, especially if you're not going to find out what's going on and make changes inside the school and inside the home, and that impact the kid. Interventions with teachers and counselors and other mental health professionals needs to occur. Law enforcement is not trained. And I'll see police officers make bad decisions, and we see those videos online when dealing with kids. And it's, I would say, as much as I want to be mad at the officer, I can't be too mad because they're not trained in that. That is not what they're trained to do. That's not a part of becoming a police officer, is learning childhood development. Or honestly, they're not learning enough about mental health, especially when the decision-making occurs when it comes to calls to the police. Most 911 calls and SWAT calls, over half of them are going to be because of mental health. And the police are not very well trained in mental health. I do see some changes, though, where they're trying to improve that, but they're typically not going to be trained well enough. Cultural competence and ADHD are very important. Understand these issues that go on with people of different races and cultures. Everyone has unique needs, and make sure that we decrease our blind spots. I cannot understand everybody in this country. I don't understand everyone's background. As much as I try to read and listen and immerse myself in people's culture, hang out with folk, I don't know everybody. So if I have a blind spot, I tell people, please let me know. It is not my intent to offend. But in order to see a blind spot, you have to actually, driving in a car, your blind spot is to the back left and to the back right. But I've got to actually turn my head to look. You have to look for where your blind spots are in order to be better to address the issues of our patients' and families' needs. So if you have any questions, please enter your questions in the box in the video player.
Yep. I have lots of questions, really good questions from people. Thank you, Dr. Higgins, for such an informative presentation. Before we start the Q&A, I'd like to share the final results from today's poll question. In your experience, what qualities or aspects have you found most challenging in the search for adequate ADHD care? Here's what you said. 29% said finding a provider that specializes in ADHD. 24% said finding a provider who is culturally competent. 17% said finding an affordable provider. 18% said finding a provider I can trust. So, yeah, now to your questions. So a few questions about presentation. Does ADHD present differently in Black and white children, and particularly at school?
I would say that I don't know. I don't necessarily believe that it presents differently. We just have to make sure that we're doing a good clinical interview of the symptoms. I don't think it presents differently, but I do believe that people may say the words differently. So essentially, as I said, a parent said that my child, look at this boy, he's throwed. All right. So I'm sitting there looking at a young man sitting there very quiet, looking like he's in the principal's office, because so often people assume I'm the school principal or something, because you're in trouble and you saw me and you're not there because you wanted to be. So I would say it does look differently in that way, in how persons may express or what are their motivations for being there, especially when you look at young girls. They tend not to be rambunctious and loud. I definitely have seen that with ADHD in girls, no doubt. But if you're quiet, you go to class and you look nice, and your parent has you dressed nice, and you're looking for it, and you're not a behavioral problem, but you're looking at the board and all parts of the board, but not looking at the teacher who's teaching, people may not recognize that you have ADHD. So I would say that the diagnosis is the diagnosis, but the presentation can be different based upon who's exactly in front of you. That's why we need to make sure that we do an adequate interview for the patient and family.
Right. You brought up Black girls, and we have a question. What are the ways in which Black women and girls mask, and how is that different from white women and girls?
Well, I would say, can't always say there's a difference, but what I would say with girls, they tend to be a bit more pleasant, when in dealing with, I would say, young girls than young boys who are having issues with behavior. The level of aggression tends to be less than I've seen with my young boys. And I would say that also some girls with ADHD, say you're inattentive, but I would say inattentiveness you're inattentive towards classwork, but you may be a social butterfly. And that can hide that there may be some other issues that are going on because you may be a very likable person. I've also seen where kids will feel embarrassed, that they're not able to keep up. So I've seen behavioral issues pop up. When I've seen Black women with ADHD, a lot of times you learn how to compensate by doing other things. But also, if you've struggled and then you've made it, made it out of the situation, you still could have symptoms of ADHD that others don't notice. So I would say that with girls and women in general, it's less likely to be diagnosed. And I don't know if they're less likely to have it, but it does present differently. And you may find yourself going into womanhood, going into areas of work that more allow a person to be ADHD. But with Black women, I've seen where they say when it comes to mental health, I don't have time for these particular issues because I've got to take care of kids. I got to take care of families. Maybe I'm a single mom with our women. So the point is, a lot of times we ignore those other issues that are going on that need to be addressed. And I've had plenty of women in general, but plenty of Black women also have said, I cannot believe I went this entire time without treatment. And simply, I didn't know or I didn't think it could be me. And now that I've finally gotten help, I've looked at all the missed opportunities for myself, but I've even had persons that say for my kids and my husband and my spouse and my family of not being able to be there like I should because I never looked at this as an issue that needed to be treated.
Yeah, we hear a lot from women in general about a later life diagnosis and how it makes things so much clearer for them to understand what they went through and how they can go forward. We had some questions from providers. How can providers be culturally sensitive and equitable in their treatment of ADHD in diverse populations? And someone writes, how can I improve my ability to see through my own biases to provide better diagnosis?
There are a lot of options, and I don't know if there's one way to particularly do it, but always question yourself on, did I do the best job I could have done? I would always ask myself, where are my blind spots? Where are my biases? And try to check them. I love the implicit bias, or IAT, or the implicit training testing that you could do online. I think it's done by Harvard. And what it does is help you identify where your blind spots are. And my thought is you won't get rid of your blind spots, all right? Because we're raised how we're raised. We've seen what we've seen, and we've been taught bad things, about other people. You can't go in your life in America and not hear racist things or different judgments about, sexuality and whatnot. And so my thought is it's not important to it's important not to ignore, but important to make sure we address and we say to ourselves, I'm not going to be biased today about this. I'm going to make sure I do my job correctly and go above and beyond because I know I have a bit of a bias towards this particular group or individual or people, and we all have those biases. Now, I know people say, I don't see race and I don't see sexuality. And I'm like, I don't know how you can not see race and differences in others, where your brain makes these prejudgments that may be grossly incorrect. So we have to make sure that we are paying close attention to what we're doing, do an adequate interview, implicit bias training, but making sure that when you're in the room with that individual patient, that I'm going to do my best. And I would say, if you don't understand, ask questions. As stated, questions don't show ignorance, they show interest. So when you ask me the question about, so as a Black male, how do you feel about having the diagnosis of major depressive disorder? That shows me that doctor is paying attention to who I am and what my needs are. And people are more forgiving of a question if you are truly interested in the individual and the impact of what you're doing and what is the impact of what you're doing on them. I think that's a good thing.
And I imagine that creates trust, which is an issue in the community as well, when you show an interest, when patients have trust issues.
Definitely so.
Dr. Higgins, we've had questions from adults with ADHD who believe they've suffered childhood trauma because their parents had untreated ADHD and all of the manifestations that go along with that, including addiction, inattention to their well-being, and so on. What are your thoughts about this? And what are some trauma-informed practices that might help them?
Well, I would say that you have to, deal with the issues of the past. And I would say a level of forgiveness, never want to carry anger to people who did the best they knew to do with what they had. All right. Understanding that if you're ADHD, there's at least a 40% chance that one of your parents has ADHD because it's very much inheritable. And, people who will say judge families or parents about what we know today versus what they did then. And I'm tell people I'd be very careful of doing that. Society has moved forward. We know more about ADHD. Chances are your parents didn't never even heard of the term ADHD. And we're possibly not even treated. And their parents weren't treated and their parents weren't treated. So we've got to be careful about the judgment. We've got to make sure we do the time and the therapy to let some things go. I do not recommend harboring anger towards the individuals. It may be good to have an understanding or a discussion with them if you feel comfortable doing so, but don't judge them by what they did. And some of them did the best they did with the tools that they had.
Right. We had a few questions involving school. How can we make schools more sensitive to Black children who struggle with academics and get them assessed instead of seeing their behaviors as a disciplinary matter?
Education, and then also paying attention to the behaviors of teachers. I was at a restaurant last night and I heard two people discussing, hey, why did this person get fired? And it was two white people. And the white male said to the white female, well, she got fired for being racist. I was like, wow, somebody got fired for being racist? Because I know people who are racist all the time and they don't get fired often at all. All right. So, but, realizing we're here in Vegas, it's a very diverse group of people who come from all over the world. And you've got a worker in your restaurant who has race issues now. And then, because I'm still listening in, acting like I'm, cutting into my steak and eggs or whatever. And he said, yeah, well, the complaints kept coming from Black people and all the Black people don't complain about all the white people here. It came from Black workers and from Black people who were paying for food. And they fired her on the spot because it's been going on for days. It was a new hire. So I'm like, wow, if the teacher is racist and they keep getting complaints, I think they should be fired. You're there to treat, to educate children, and you've got a bias that's causing some children not to be educated. Even if that's 10% of the room, you got 10% of the room who has a problem inside your classroom. Yeah, I think you should be fired. And if this is a problem in your district, we need to pay attention to that. So I would say that we have to stop allowing certain things to happen. We do need to educate individuals, but I would think that if you got fired for one thing on your last job, then on your next job, you do better with it. And trying to not allow toleration of that behavior inside of our school systems where kids are supposed to be getting educated. I was talking to a family the other day. Kid has ADHD and autism. And she was like, at this school that is 90% white, why is it why in that special classroom for math for kids who are falling behind, it's only 4 Black boys. It's 4 Black boys in that classroom out of this whole school. How does that happen? I'm like, well, I'm assuming that's some kind of structural racism issue. And that if less than 5% of that school is Black, but all the ones who are in this one lower class are Black, that tells me there's a structural problem inside of that class, inside of that school itself. And you got to make sure that you're paying attention to that and realize that, no, you're not crazy. You're looking at the numbers and it's not haphazard for that to occur.
When teachers suspect ADHD in a child and the parents are resistant to get the child evaluated, especially if they're a white teacher and a Black family, how can the white teacher talk to the Black family in a way that won't conjure negative feelings, but that is just working to try and get the child evaluated? for his or her own best interest?
Well, I would always recommend that you've got to let a family know if you think that there's something going on. And, so being honest, having information will help, things to look at for them to make a decision. So, I would say your child has ADHD is not good enough. You've got to make sure that you're doing all the things that you need to do, but also you have to be careful of, well, because the family won't trust me, I'll decide not to share the information because they won't listen anyway. So we'll just continue to struggle in the classroom. Also looking at what you could do in the classroom yourself as a teacher. If you notice that the kid is having issues with focus and attention, moving them up to the front, making sure that you stay in communication with the parents. You don't have to wait for the IEP. And I used to teach school. All right. So, you don't have to wait for the IEP to make an intervention inside of your classroom. So you have to let the parent know. But you don't have to wait for them to do something. You can actually start to do things on your own. As a point of self-disclosure, I remember my daughter, we moved from a mixed neighborhood to a heavily white neighborhood. And then the school was one of the best in the country. I won't even say they were certified by Ivy Leagues and all this. And we got there and our child started doing poorly. She started to regress in her development and even in her learning. And I had a teacher to tell me that they felt like that my child was, not developmentally up to par with, other kids in the classroom. We may want to consider other resources. Now, realizing that the teacher is a 17-year-old rising junior in high school, talking to a child and adolescent psychiatrist and a pediatrician, which was my wife.
Wow.
All right. So I've seen this myself, where my child doesn't have autism, or whatever she thought was going on, but it was a problem in the school. And then we changed schools, and all of a sudden, my daughter was doing well again.
Wow.
So these are real things that happen in the community that can even happen to ourselves. So what if I believe this person, and now I'm taking my child in for developmental testing? To look for and find issues with autism, and they pick up something, and then I have paperwork and we take it to the school, yada, yada, yada. And, not to mention she's in college now with a 3.7 GPA and doing, looking at an internship with the NASA related company. But I'm like, okay, it's time for us to go. It happens to us. Now, I don't believe she knew I was a child psychiatrist, my wife's pediatrician. We are the people who do this work. But no, you can't trust everybody. That's a fact.
Well, unfortunately, that has to be our last question because we're out of time. But Dr. Higgins, thank you so much for joining us today and for sharing your expertise with our ADHD community. We appreciate you.
Thank you all so much for having me. I greatly appreciate it. I look forward to working with you all in the future. Just let me know. Call me up.
And thank you to today's listeners. If you would like to access the event resources, visit ADDitudeMag.com and search podcast 495. The slides and recording are posted a few hours after each live webinar. If you're listening in replay mode, simply click on the episode description. Please know that our full library of ADDitude webinars is available as a podcast. It's called the ADHD Experts Podcast, and it's available on all streaming platforms. We hope to see you again next week for a free webinar on the social struggles that many adults with ADHD experience when building friendships. Make sure you don't miss future ADDitude webinars, articles, or research updates by signing up to receive our free email newsletters at ADDitudemag.com/newsletters. Thanks, everyone. Have a great day.